Rush was a doctor, was an actual physician, one of the founders of the country, signed the Declaration of Independence, and he served more or less as America's first Surgeon General. So rather than just a pundit or somebody who was a warrior, we thought it would be good to find an actual founding father and doctor, and that's the person after whom the organization is named. This is Benjamin Rush in his youth, Benjamin Rush in his middle age, and then we have Benjamin Rush in his old age down there, right here. And I'm told that Benjamin Rush was the youngest graduate of Princeton University to date. Is that correct?
Yes, the age of 14.
And he graduated Princeton University at the age of 14.
And it was a 6-year college, and you had to know ancient Greek and Latin in order to get in.
Just like you.
Exactly.
You need to know it on the way out, right? So
yes, I am a former tour guide.
That's, you know all the details about that place. So that's basically the background on the Benjamin Rush Society. And we'd like very much to develop this as a vehicle for getting these ideas out. We'd love to have your participation. Participation on the parts of others who you may know could be helpful who are not here tonight. And so we encourage you to be active in this organization. We thank you for being here. And I'd like very much now to turn it over to one of our co-founders, Sally Pipes, who's here from San Francisco, and she'll tell you even more about the Benjamin Rush Society. Thank you very much.
Well, I'd like to send my thanks for all of you for coming. I know it's busy, the president's in town, so you diverted from that to coming here, so thank you. I'm Sally Pipes, president of Pacific Research Institute and the progenitor of the Benjamin Rush Society. But I would really like to thank Deroy Murdock. I've known Deroy for a long time. We're old friends. He has been very helpful. He was at the original meeting in May 2008 where we met in Washington at MNAC to talk about, what should we do. And we had a group of doctors, Reggie Hertzlinger, Scott Gottlieb, we probably had John Graham. We had about 15 people and talked about whether this was a good idea. And Jean Meyer, of course, from Federal Society, from whom I copied the Benjamin Rush Society idea. And so it's been great fun. It was funny because what to call a Benjamin Rush Society. So my husband, who's a professor at Claremont McKenna College, when I was talking about this, he's an expert on the founding, said we should call it the Benjamin Rush Society. So, okay. Then I go to the meeting and Deroy says, well, I've come up with a name. It's the Benjamin Rush Society. I thought, that's a great idea, Deroy. So that's how we called it. Why the Benjamin Rush Society? John's going to really talk about the organization and what we're trying to do. And then, so John, thank you for becoming the executive director. He's really doing a great job taking it over. It's hard to get things going, but John is terrific. And also Felicia Horton from Docs for Patient Care, who we're working with, and Hal Schurz and all the group at Docs for Patient Care. We've got a really, I think we're really building a mass. So we can all fit in a phone booth still, but we're building a mass. So why BRS? Well, I'm from Vancouver in Canada. I grew up under a government-run healthcare system, worked at the Fraser Institute, where John did too, but after me, moved to the U.S. 20 years ago to take over PRI. One of the reasons I jumped at the opportunity to come to the U.S. was the Canadian healthcare system, long waiting lists, all of these things, ration care, and lack of access to the latest technology and treatments. So I moved to San Francisco to run PRI. But my best friends in Vancouver, the Chambers, had 3 children. Keith was a medical doctor. He practiced, and at age 40, he said, I'm giving up. I'm retiring from medicine. I can't take it anymore. I have to see 55 to 60 patients a day. I can never get the test. My practice is full of people who are old who just want a little outing, so they go to the doctor. I can't, so he quit. So they then sent their 3 children to Claremont McKenna, where my husband is a professor. And their middle son, Lockie, graduated from CMC and went to Columbia Medical School. Graduated from Columbia. He's just finishing up his 6th year in orthopedics at UCLA, and he's going to be coming to New York to do a year's fellowship at the Hospital for Special Surgery. But poor Lockie said, I came to the U.S. to study medicine because my dad got out of medicine because of the Canadian socialist system. It's like it's following me.
Thank you very much. I reiterate what Deroy and Natalia said. Thank you very much for taking your time to come here. And I'm going to get a little organizational on the issue and say what we're hoping that you doctors and neuroscientists and friends can help us do with the Benjamin Rush Society here in the New York area and in Connecticut and New Jersey. In terms of the organizational structure, I'll just take 2 seconds. This is very boring kind of housekeeping, but Sally is the president of the Pacific Research Institute, and I'm the director of healthcare studies at the Pacific Research Institute, which is a 501c3 nonprofit registered charity. The Benjamin Rush Society is a project of the Pacific Research Institute, which has a goal of becoming its own 501c3. We've had success raising money, especially in the last 2 months. We've raised quite a good bit of money. So I'll explain to you what we do with the money. And primarily what we do is we found chapters at medical schools, just like the Federalist Society founds chapters at law schools and underwrites events meant to communicate the values of the Benjamin Rush Society. We do have a handout here. I'm not going to read to you verbatim. I'll read you the first paragraph. It says, what is the Benjamin Rush Society? It's an organization that unites medical students, residents, fellows, and doctors from across the political spectrum, as well as members of the general public, who believe that the profession of medicine calls its practitioners to serve their patients rather than the government. We believe the doctor-patient relationship is voluntary and a mutually beneficial one. Both parties have the right to input freely, and the proper role of government is to protect this freedom, not to diminish it. So there's the overarching value statement, which we believe, as a result of Obamacare, is threatened. That's not to say it wasn't threatened before Obamacare. As Sally explained, we believe, and when we talk to doctors, when we talk to medical students, our understanding is confirmed that at medical schools, to the degree that they get any message of a policy or the role of government or what is right in terms of health care, it tends towards single payer, it tends towards government monopoly, and the more, the higher, more prestigious the academic medical center, the worse that message seems to be. Harvard Medical School being kind of the worst, ground zero for this kind of awful stuff, where of course, there are many doctors who are very high profile and whom you know the names, Marcia Angel and people like that, who are continually communicate government monopoly. And we now have, right now as we speak, we have 10 live chapters. What I mean by live chapters is we have a medical student whom I can pick up the phone to, and he can pick up the phone to me and say, I want to do an event, and we can talk about it, we can plan it, we can recruit speakers, and we can get the medical students and the faculty to come and attend these events. The chapters are University of Cincinnati, University of Colorado, Duke, George Washington University, Robert Wood Johnson, just down in New Jersey, University of Texas Health Sciences Center, San Antonio, Texas A&M, go Aggies, and Wake Forest. We have one undergraduate chapter at Hampton-Sydney College for pre-med students down in Virginia. And I would say the most successful chapter, I'm very glad to say, is Harvard Medical School, where we've now gone through, we're now into a third generation of leadership. The first generation passed to the next one, passed to the next one, and they are going to have a major debate in May, and Robert Wood Johnson is going to have a major debate in April. Now when I say a major debate, I mean 4 debaters, 2 on one side of a resolution, 2 on the other side of a resolution, about the government and health care. For example, the federal government's responsibility is to ensure equal access to care for all Americans, or something like that. And we have a high-profile moderator as well. So for example, the last debate at Harvard, Dr. Flyer, the dean of the medical school, was the moderator. We have very high-profile faculty members debating the issues. Of each team of 2, we like one to be an MD. Sometimes 2 are MDs. Sometimes the other one is more of a health economist or a social scientist, let's put it that way, who understands or has a perspective on the role of government in society. So these are labor-intensive to organize, and they cost money. So we need to raise money to put these events on. And we've been successful in doing that. We also communicate to the general public. We've got a website, BenjaminRushSociety.org. It's easy for you to find. And on that, we put up photos and videos of all the events we have. We put up written reports of all the events we have. We have information there. If a medical student comes upon that website or learns about it, they know how to get in touch with me, call me, email me. I want to start a chapter. And there are others, I haven't named them here because we haven't got them up and running yet, but every week I get an email from at least one medical student who says, this is what we need, let's get a move on. And so I start discussions with them. We have a Facebook page. Everybody has a Facebook page, but you got to say it because donors want to know you have a Facebook page, right? And we have a Twitter feed, and so we're trying to make use of social media as best we can to get in touch with these folks. I understand that at medical schools now, like at business schools or law schools, when you show up, they give you an iPad, and your curriculum is on the iPad. So we want to make use of that at all. Now, finally, and not to bore you, one why did we invite you here? Deroy said, you know, we really need to get chapters down in New York. There's great medical schools in this area, in New York itself, in New Jersey, in Connecticut, and we need to get thriving chapters with breadth and depth. And Deroy said, I can invite some folks who can help you with that. So what our hope is that you, ladies and gentlemen, will either know faculty yourself or have direct contact with medical students. We do have one medical student, Mr. Hurwitz here from NYU, that you can help us reach out and touch medical students who will take leadership and stand up and say, I will found a chapter at NYU or Columbia or wherever in the metropolitan area. We're also hoping that if you're so motivated, you'd like to speak at events, if you have a perspective on the role of government in medicine. And we would like it if you would communicate to your fellow physicians, be they in faculties or in any position of leadership at the County Medical Society or the Specialist Society, what we're doing and what we're doing that's a little unique in terms of training, well, not training, but influencing the medical students and providing them an environment where they can resist and understand and develop alternatives. One of the things, as the evening progresses, I'm hoping that, because we're not physicians, neither Sally or me or Deroy, that you can tell us what you think medical students would like. Some people have said debate can be good in some environments, but maybe not in other environments. It's not really the culture of medical school. So if there's other events that you think would be good for us to develop, we would appreciate that. And hopefully we will raise a generation of young doctors who will understand that government in medicine today and in healthcare today poses a threat to our access to healthcare. It does not improve our access to healthcare.